Good evening, afternoon, and morning. I'm Richard Ponzio, Director of the Just Security 2020 program at the Stimson Center in Washington, D.C., and it's my pleasure to welcome you back to the WISH Summit with its vision for a healthier world through global collaboration. Our session today is co-sponsored with the Doha Forum. It's on geopolitics and the global response to COVID-19, which will examine through the prism of global governance how the international community is coping with one of the biggest challenges to confront the United Nations since its founding in 1945. This session will hopefully nicely complement the COVID-19 panel on day one of the WISH Summit earlier this week, where Dr. Tedros, the Director General of the World Health Organization, promoted the COVID-19 Tools Accelerator, which, as you know now, ensures the fair allocation of vaccines, therapeutics, and diagnostics. A point of departure for this discussion is our upcoming 2020 Doha Forum report entitled Coping with New and Old Crises, Global and Regional Cooperation in an Age of Epidemic Uncertainty. And we will consider in this panel, first, the initial international emergency response to COVID-19, including from some of the major global players, the United Nations, the G20, and the World Health Organization. Secondly, how the international business community has partnered with international organizations and governments in this effort. And finally, a few of the key dimensions of what we're proposing as a 3-year socioeconomic and green global recovery program from the pandemic. So we're very fortunate to have with us 4 distinguished and talented panelists. And while you can find more details on their bios on the WISH Summit website, I will give you a few tidbits on their background in the order that we'll be hearing from them today. Mr. El-Haj Assi was recently the Secretary General of the International Federation of Red Cross and Red Crescent Societies. He, particularly germane to our discussion today, has been named in recent years the co-chair of the WHO's Global Preparedness Monitoring Board. He's also the chair of the Kofi Annan Foundation in Geneva. Then we're going to hear from my colleague, Professor Juris Larik, who is an assistant professor at Leiden University and a senior advisor at the Stimson Center. He will bring to our panel expertise in the areas of international law and global governance reform. Also from the Stimson Center, my colleague, Christina Petcu, who serves as a research associate at the Stimson Center. She's a native of Romania, and prior to joining Stimson, she served in various roles at the United Nations, including the UN Office on Drugs and Crime in Guatemala. And finally, we're very pleased to have with us today Mr. John Scheffler, who is the Executive Global Government Affairs Leader for GE Healthcare, where he also served as a senior leader of government relations. Prior to GE, he spent nearly a decade in senior positions with the American Healthcare Association. So following 2 rounds of initial Q&A, we'll offer the opportunity to hear from all of you, our global audience. And so we encourage you to begin using the chat function throughout our discussion to submit your questions, ideally naming yourself as well, the country you might be coming from when you're posing your brief question, please. Let's kick things off with Mr. C. The current geopolitical context has made it extremely difficult to reach consensus and bring about effective collective action. The UN, G7, G20 have all been affected in this way. In addition, we've witnessed the phenomena of vaccine nationalism, with national self-interest and potentially undermining the global effort to ensure that vaccines are used most effectively and equitably to stop the pandemic. Is there a way forward out of this situation, and what do you see as the way forward for increasing effectiveness of the multilateral system? Mr. C.
Thank you very much. As you rightly said, when we are confronted with the shock and the hazard of the magnitude of this pandemic, it on the one hand reveals the dysfunctionalities that we have in our systems. On the other hand, it even exacerbates those dysfunctionalities. So what we have seen even before was that the world was at risk, and that was the title of our first report of the GPME. We were calling for responsible leadership. We were calling for active citizenship. We were calling for early alert, early warning, early action. We were calling for building capacities to strengthen the resilience of communities to withstand the shocks. We were calling for partnership and solidarity. But none of that was really heard. What we nicely call the vaccine nationalism, it is an egoism that started, with a fierce competition for masks, PPEs, drugs, hand sanitizers, forgetting that in a pandemic, nobody is safe until we all are. So what do we need to have there? We know that civil society organizations play a role. They have not been involved sufficiently. We know that pandemics starts in communities and then they will end in communities. And until and unless they engage, and then we are accountable to them and be them part of the solution rather than being seen as a problem, we will not see the headway that we would like to see. If we do not give back the authority, to the institutions such as WHO and fund them adequately, if we do not have the political leadership, politics that should be part of the solution and not be a bottleneck, and on the other hand, an activism which is building a community of carers, that will be holding leaders responsible to deliver on the promises that they have made, for the well-being of their populations and their citizens. If we don't do that, trust will continue to be eroded. If we don't do that, then we will leave a space for naysayers, for fake news, for anti-vax and all other things that are developing and then becoming a threat, to us. That's the reason why we are calling in the GPMB and then together with other partners, that the multilateral system needs to be looked into. And then we build bridges between the international financial institutions, the WHO, the UN, the G20, and every country, every leader. Nobody should be left off the hook, be they rich or poor, to see health as an investment that will be having dividend and not only as an expense, which is often seen as a kind of a social expense. Now, COVID-19 is reminding us that very, very fiercely, and then we hopefully will now to take back and then see alongside some of the proposals that we make to the UN to hold a global summit of health and security globally, to put all the pieces together and heal what is broken, which is this global solidarity and the multilateral system that works for people.
Thank you, Mr. C. Good way to kick off our discussion. Nobody's safe unless we all are. Professor Larek, unsurprisingly, the World Health Organization has been a regular feature in the international media since the start of this pandemic. In connection with the upcoming report, the Doha Forum report, how do you and your co-authors perceive the various criticisms launched against the WHO in handling the pandemic, including from the United States, but also governments regarding China, as well as regarding the WHO's change in messaging regarding the utility of face masks?
So, thanks, Richard. And in the first instance, it feels always very unfair to criticize the WHO because it is kind of where the buck stops in global health governance. The world only gets as good a WHO as it is willing to fund and provide. Also, we have, I think, in our assessment now, declutter it a little bit from a lot of the quite overtly hostile rhetoric from the now outgoing U.S. government, the Trump administration. Nonetheless, though, I think some of the criticisms also came from other quarters, as you mentioned. Other governments criticized the WHO as well regarding, perhaps it should have declared the coronavirus a pandemic, an international health concern sooner. It should have mandated or strongly recommended face masks sooner. Maybe that's an important lesson for the future. Just act in an even more precautionary manner, seeing the cost and suffering that it does cause if you don't take action very early, seeing the very global spread of the virus. And for the rest, I think looking at this from a larger perspective, and maybe a lesson for international organizations generally is that we saw the WHO become this battleground in this US-China standoff, and that's really then where the rest of the world suffers. Because the distracted WHO from its core task, and if you happen to be a smaller country, a poorer country, then you really will suffer also very much down the line. So I think one big lesson from this is certainly yes, as Mr. C already said, fund it more, equip it more adequately, but also make it less susceptible to becoming this this plaything of the great powers, and something that can really dedicate its full energy to helping everyone, including smaller and poorer countries around the world.
Thank you, Professor Larrick. Ms. Petku, as a member, too, of the forthcoming Doha Forum report team, and building on Professor Larrick's response, what's your assessment of how intergovernmental bodies such as the World Bank and other institutions at the regional level have responded to the international financial, economic, and the social or human impact of the COVID-19 pandemic? Do you feel that there's been sufficient post-vaccine recovery planning underway by these international bodies now that we know that the vaccine is imminent?
Thank you, Richard, and to all the participants that are joining us today. And grateful to share this panel with such distinguished experts. Faced with a common borderless threat, the global and regional institutions indeed mobilize to facilitate cooperation and identify comprehensive plans of action to address the unfolding human, economic, and social crisis caused by the pandemic. The COVID-19 Tools Act Accelerator, the United Nations Framework for Immediate Socioeconomic Response to COVID-19, and the G20's Debt Service Suspension Initiative are just a few of the many response plans that illustrate the type of coordinated action required to combat this global threat and ensure equitable support for development and for developed and developing countries alike. However, prevailing fragmentation, under-resourcing, persistent delays, and ad hocism among global and regional institutions has only heightened during the first months of the response. Global and regional recovery efforts remain still inadequately funded. For instance, between April and early November 2020, only 24% of the UN's public appeal has been met for its $10.3 billion global humanitarian response plan, and only 6% has been raised for the initial $1 billion COVID-19 Response and Recovery Trust Fund, even as donor countries pumped trillions of stimulus spending into their own economies. At the regional level, you asked about the regional level, different vulnerabilities along with diverse regional structures showcase the effectiveness, but also the limitations of regional organizations to coordinate and support national responses. In Latin America, which became the epicenter of the crisis in May, despite a series of short and medium-term proposals from the UN Economic Commission for Latin America and the Caribbean, ECLAC, regional organizations have failed to unify and mobilize a regional response. This only reflected the regionalism crisis that exists in Latin America, where we see actually a veritable alphabet soup of overlapping regional and sub-regional arrangements. On the other hand, other regional blocs, such as the European Union, which has also been the epicenter of the crisis early in the year, is one of the only multilateral bodies that is now negotiating a long-term 6-year recovery package amounting 1.8 trillion euros, which aims to create greener, more digital, and more resilient Europe. At the same time, the undermining of global institutions, norms, and cooperation over the past years has further strained the multilateral system, which paradoxically is key to confronting present and future transnational risks and challenges. And this lack of coordination also and lack of effective planning hindered the international community's ability to manage the situation, let alone develop a coherent medium-term, let's say for the next 2-3 years, that is a post-vaccine recovery plan that should be conceptualized earlier rather than later, as we can't wait for a vaccine to become available before we start thinking about a global comprehensive recovery plan. Still, the adoption of the 2 related UN General Assembly resolutions on COVID-19 response in September, as well as the UN 75 declaration, which was also adopted in September, suggest broad-based political support for environmentally sensitive recovery plans essential to building more inclusive and just societies. And in this vein, we've seen recently that it was announced that on December 3rd and 4th, the UN General Assembly will hold a special session at the heads of state and government level in response to COVID-19, and we hope that this will be an opportunity to catalyze long-term collective action to address the global pandemic and its impacts. Thank you.
Thank you, Ms. Petcu. I'd like to pivot briefly to focus a bit on the role of non-governmental actors, especially the private sector response to the COVID-19 crisis. So we're delighted to have, of course, Mr. Scheffler, a representative from a major multinational enterprise, GE Healthcare. Prior to the current pandemic, we understand you had a relatively modest ventilator business. We'd be grateful if you could share with our global audience some details and any insights or lessons that you've taken from the rather remarkable partnership you've had in recent months with Ford Motor Company.
No, thank you, Richard, and to the panel, thank you. I'd be happy to. I think as I've been thinking about this pandemic crisis like we all have, there's nobody who has experienced it more intimately and more soberly than the frontline caregivers and the patients that suffer from COVID. There's a role for the private sector, and look, for us at GE Healthcare, you know, it was the second week of March, and all of a sudden we heard the same things everybody heard. Italy was in a bad way, and little did we know that in a short period of time, New York City would follow in a bad way. And what we realized as a company is a med tech company is we manufacture equipment that can be useful to the response. Look, I think the systems, the institutions were very much pressure tested. And as a private sector person and playing a role in that, I can share with you how hard it was. And some days you didn't wake up because you never went to sleep. And the days that you did wake up, you wondered how you were going to kind of hold the walls up and keep it together. The demand for ventilators, you know, spiked thousands and thousands of % overnight. We have a ventilator business at GE. And even within that, we were able to increase our capacity by 3 times. And that wasn't going to be enough to meet the world's needs. So as a company, we kind of came together with our engineers, our manufacturing leaders, our government affairs leaders to sort of assess a few things. And I think the first thing we all had to look at was safety. How do we keep our own employees safe? How do we keep our suppliers' employees safe? If they aren't safe, no one will follow. And we developed protocols right away to ensure the continued manufacturing of our ventilators that we make at GE Healthcare. Then we had to assess what is our inventory? What can we provide right away, and how do we allocate it? And that became a very important partnership between industry and governments, is how do you secure enough ventilators to get to all the places in the world that need it? It's made more complicated because of the supply chain. Most of the companies, and there are 8, 9, or 10 companies that manufacture ventilators, and we all are reliant on a global supply chain. So while you're looking at Southeast Asia, Malaysia, India, Europe, the United States, Canada, parts are coming from all over the world. And how can you run your logistics operation to make sure that the parts that are coming from these countries are also going to benefit from the products that we make? And so securing your ability to meet the world's needs and not get sucked into sort of a nationalistic approach and finding that right balance. Those were the challenges that we faced. As we looked at our own inventory and our own capability, I think there was a sense of urgency, certainly among the U.S. government and our partners. And other industries stepped up to say, hey, we have capacity here. We're Ford Motor Company, and we have a line that we could convert to make mass-produced ventilators. And so we partnered with Ford, and sort of in a short period of time, we worked through a lot of challenges, engineering design, patents, service, and we came across a simpler model of a ventilator. The GE ventilator has over 1,500 parts. This required fewer parts. It did not require any electricity. And we were able to partner with Ford, and they did a terrific job of converting their manufacturing capability to generate 50,000 ventilators. And we were able to use those in the U.S. The U.S. government has the ability to share those outside the U.S. And look, there were days where you weren't sure if you were ever going to make enough ventilators to meet the world's needs. And then after sort of 6 to 7 weeks of a concentrated effort, 20-hour days from the manufacturing lines to those of us in government affairs to to keep the logistics flowing, the supply chain flowing, it operating smoothly, we were able to meet the demand. And right now, there are enough ventilators to meet the need. And I think what we're doing as a company, and I think the other vendors that are in the same space would be looking, what can we learn from what we went through, so that when there's the next challenge, whether it's in monitoring or what other types of equipment, or even on the pharma side, what are the things that we can look back, assess what we did, what we could do better, and incorporate that into our plans going forward. And I would close just saying, when we woke up that first week of March, I don't think any of us anticipated this thing being like this. And it forced our companies to rethink how we prepare for the next one. And that's what we're doing right now as a company, is trying to ensure health security across the globe so that everybody has access to it. It's hard, it's complicated, it is doable.
Thank you, Mr. Scheffler. It's a remarkable story, especially the complexity of the supply chains involved. Mr. C, I'd love for you to any reflections about the broader topic of private sector, civil society, their response to the pandemic. But given your many years with international organizations, are governments and their intergovernmental bodies doing enough to coordinate, facilitate the contributions of these non-state actors?
Not enough. We clearly see that there are some progress have been made over the last years. You may have heard about the Global Compact, that was put together in the UN. We have seen Davos after Davos meetings, some kind of rapprochement between the private sector and then the public sector. We've seen champions of industry also individually caring themselves, and by so doing, driving their societies, their companies, and the communities where they do business, towards responding to the challenges that are relevant to society. We're seeing more and more about that. Because for me, what I see the positive development is that beyond the titles that people carry and the status, there are human beings, and some of them simply care. And because they care, they drive that. And I think what Mr. Scheffler was talking about, it is not only about doing good business, it is not only about making money, it's about, simply put, caring, as a human being and as a leader. And that is the type of leadership that we need at all levels, in the private sector and also in the public sector. But we need to create that enabling environment where trust can be built, where respect can be built, where accountability will be there, and we build the partnerships that are required to move towards that. And the accountability in particular, namely delivering what we promise, which is supporting people, investing in their well-being, which is also addressing the needs in the communities where we do business and the communities where we are also responsible. And I think that is all of that comes together. And in times of crisis, like this one, it is revealed. Today we talk about COVID. Before we're talking about climate and all those other shocks and hazards that remind us very simple things. There is only one planet that we all share, and we need to protect it. There is only one humanity that we all share, that we need to care for it. And that's, I think, that movement of carers, the movement of solidarity that we need in the international institutions, that we need in the multilateral system, and we need in a new form of partnership and collaboration where there will not be no more them and us, but we, an inclusive we, that will be working together in the same line. But the leadership is critical there, and we need that kind of a leadership, which unfortunately quite broken down at the political level. And then we hope that it will be rebuilt, and we will see more and more that kind of a leadership emerging from private sector and the civil society, and I hope that the movement will be carried forward.
Thank you, Mr. C. I think, you're getting at the heart of the matter. It can't just be whole of government approaches to deal with this monumental challenge, but whole of society and whole of government approaches at the global level, given the nature of a pandemic. But in this last segment, and I hope our panelists will have relatively brief responses so we have time for exchange with the global audience. But we'd like to look ahead. Now that the vaccine is imminent, we can seriously talk about economic, social, even the environmental dimensions of recovery. So back to you, Mr. Scheffler. GE is a well-known global corporation, big in the aviation and energy sectors. A lot of talk about a green recovery. What does a green recovery mean to a company like GE?
Yeah, thank you for the question. Look, I think one of the fun things for me about working for GE is when we get tired of working on healthcare issues, I can walk down the hall and talk to our friends in aviation. And if I get tired of that, I can go talk to our power team or our renewable energy team. And even within GE, we have a lab. We have an innovation lab. It's our global research center. And I think one of the things that's exciting is the Honorable Mr. C talked about the other threats that are on the horizon, including climate change and the things that keep us all up at night. GE has been a heavy player in the power space for a long time. It has made dramatic commitments and investments in the renewable energy space. And I think the good news is we continue to see increased global demand for renewable energy. For GE Healthcare, it's largely wind-generated power. That did not take a dip during COVID, so we're happy to see that the demand is there and it's growing. And I think the big challenge for us as we think about green energy is how do we as a company work with governments, again, to drive down the cost so that it's affordable and accessible to everyone. And we haven't cracked that nut yet, but that's something that we think about with regard to our growing renewable energy portfolio. How can we better position ourselves with governments to have a human conversation about what is best for the world, how to get it done quickly, and how to make it accessible to consumers around the world in every market, including emerging markets.
The human dimension is absolutely front and center of everybody's mind. Of course, the pandemic is still ongoing, but Professor Larick, looking back at just the last several months, what are some insights, lessons you take for future looming global crises, even beyond pandemics?
Yes, thank you. Well, I think the one important key is certainly in realizing that these global challenges always will require a multi-stakeholder approach. And we've talked a lot or heard a lot in these past months about the crisis of multilateralism. But multilateralism alone won't be able to tackle any of them. And there I just like to add that you don't need to be a global corporation. Of course, if you're GE or other global corporations, you can make massive contributions in various areas. But in our forthcoming report, we also included stories of small businesses, small NGOs around the world doing their part in tackling the pandemic. Maybe one reminder I'd like to add as well. Of course, 2020 will always be known as the year of the corona crisis, but it also is the 75th anniversary of the United Nations, something that almost got a bit sidelined by this, but at the same time reinforces the necessity of a global organization like that, but also of multi-stakeholder approaches. It really goes back to the opening words of the UN Charter, we the people. It's not just we the states, we the governments. So in a way, that message was already included there. And in many ways, I can only say, thank God we have the UN, and thank God we have also a track record of experience with multi-stakeholder collaboration in various areas, including health. And that allowed launching things like the COVAX facility and the access to COVID-19 tools accelerator facility. I mean, of course, these things can be better, can be improved, but they're absolutely essential for tackling this particular crisis. And I think they will also contain many lessons for other looming and ongoing global challenges and crises.
Thank you, Professor. So while Ms. Petku again, while a vaccine may only be available for wide distribution in 2021, hoping you could speak a little more to the forthcoming report that you're part of the team in supporting. What are some of the priority elements or innovative ideas that are being put forward for a durable, green, and broad-based recovery from COVID-19? But does it also have something to do with our system of global governance that Professor Larick referred to in the context of the 75th anniversary of the UN?
Indeed, and thank you, Joris, for making it easy for me and just laying the groundwork for emphasizing the need for multilateralism and the response, how critical the response of these global institutions has been. But I'm going to pivot and speak a little bit about the need for revitalization, particularly in the context of recovery. And in the report, we think that, and we're suggesting that the 3-year global green recovery effort and complementary sequence of steps to renovate and upgrade our global and regional governance institutions have become imperative. In the report, we're also saying that the recovery effort should address itself to 4 critical dimensions of global, national, and local interaction, which in the interest of time here, because I like to get to your questions, I will not mention, but I do encourage you to read when the report is published at the beginning of December. On institutional revitalization, because I think that's the critical aspect here that people will be interested to hear about, the report highlights one recommendation from recent, more detailed studies for each one of the main pillars of the UN. For the peace and security pillar, we recommend the much enhanced UN post-conflict civilian response capacity that would facilitate rapid deployment of civilian skills in conflict prevention and peace building efforts worldwide. For the sustainable development pillar, we call for better alignment of the UN and G20 priorities. We're calling it a G20 plus that could accelerate recovery from COVID-19. And for the human rights pillar, we suggest stronger working ties between the UN Human Rights Council, the International Criminal Court, and the UN Security Council that can reinforce the effectiveness of each other. Culminating 3 years of work in the service of global pandemic recovery and revitalization of global institutions, the report proposes a World Summit on Inclusive Global Governance that should be convened in September 2023 at the start of UNGA High-Level Week in New York. The 2023 World Summit would seek to upgrade and equip the global governance system to address major issues facing the international community and to usher in a new compact with citizens to engage and rebuild confidence in multilateral institutions. With the recent news on the expected arrival of one or even more effective vaccines, the road to recovery must avoid a return to the old normal of unsustainable practices as it relates to confronting a far greater challenge than the coronavirus. And I believe that in the minds of all of us all, it's actually climate change. So I'll stop here. Thank you so much.
Great. Well, this time we do have more than 10 minutes to hear from our global audience. And there is a brief interlude, and then I'll share some of the questions posed to our panelists. Welcome back. So our 4 questions, I will wish to pose the first one to our colleague Christina Petku, who just spoke, from Habas Hawal. His question is, how have international agencies that led to the response to COVID-19 adequately addressed underprivileged communities, specifically looking at health disparities that are linked to race that have been exacerbated during the pandemic? And then for our colleague, Mr. Scheffler from GE Health, very interesting question. We don't have the author's name, unfortunately, but there's a lot of talk today about acting together. But can you comment on the value of many jurisdictions learning and acting separately and uniquely? Of course, this is how the private sector is organized around the world. So the value of hundreds of small laboratories of discovery. And maybe you can add to that how the public sector can encourage innovation through the market. Mr. C, 2 questions that are closely related. Can you comment on the growing fear of politicization of the COVID-19 vaccine, building on your comments earlier about vaccine nationalism? And then specifically, do you think that the United States will make a significant contribution to the Global Vaccine Alliance, Gavi, after the major announcements this month and the contributions that are also being made by European countries? And then finally, for Professor Larek, we have a question from Al-Jawara Al-Mana, whose question is, what is the role of civil society organizations in combating COVID and in socioeconomic recovery post-COVID, building on part of our discussion today very much so. Ms. Petku, the first question is over to you.
Thank you, Richard. Thank you to all of you for your very thoughtful questions. I will try to address the question on the responses to COVID-19 and whether or not they adequately addressed underprivileged communities. And while the report itself and what we've been researching thus far focus more at the national, regional, and actually global context, we've seen in our research that there is definitely a big discrepancy, of course, in the capacities that different countries have, which also speak, of course, about the capacity that they have at the local level to respond to COVID-19. I can think of one of the numbers from the report, which says that 40% of the world countries have less than 10 doctors per 10,000 people, compared to an average of 30 per 10,000 people in high-income countries. So also the limited fiscal space available to low and middle-income countries have also undermined their ability to fund comprehensive stimulus plans that and roll out emergency responses, and therefore be able to help more those vulnerable populations. We have also seen that those that have been actually most impacted, of course, we're speaking here about generally the various groups within a population that are vulnerable, such as women and children and some other groups. But we're also seeing a big impact on in countries where there's the informal sector is prevailing. Therefore, unemployment benefits on average are only available in these countries to less than 2.5% of the population. So yes, there have been responses. We've seen the World Food Programme actually winning a Nobel Peace Prize for trying to combat famine, which is actually a big problem, and it's expected to get even worse in the coming months. But at the same time, of course, more responses are needed, and especially responses that target vulnerable populations.
Thank you, Ms. Petku. Mr. Scheffler, laboratories for innovation. What more, do you agree with that premise and that question? And of course, what kind of suitable conditions, environment can the public sector encourage for those laboratories to really reach their full potential?
I appreciate the question. Look, I think the laboratories of innovation, and who's against that? I think they're up and they're running. I sort of took the question to be more along the lines of how do you manage through jurisdictional chaos, right? And COVID presented to us the greatest opportunity for a global response in our lifetime. What can we contribute and how can we do it? I think were the questions we asked to ourselves. So as I think about the question, two things. One is from a innovation lab thing. Everybody's got something to contribute, and even certain companies can pull from other parts of their company to direct resources to solve, create the mousetrap that saves the world. And that's what we try to do at GE. I think we want to work with our suppliers to do the same thing. The challenge for us at GE was managing the chaos piece of this in the jurisdictions. So the world's on fire. You've got to get something delivered tomorrow. You need to make sure that the environment for your suppliers that are working in Malaysia can get to work. And what do we need to do to make sure that the place where they're working is safe? They have permission to actually go and work there, and that they actually want to go and work there. And then when they make the component part, how do we get it from Malaysia to Wuxi, from Wuxi to Singapore, from Singapore to Bangalore, and from Bangalore to Madison, Wisconsin? And so those kind of logistics were just an overwhelming challenge. But the world worked together in large part. As I said before, the systems were tested. And in large part, it wasn't perfect and it wasn't easy. But in large part, the systems actually came together because I think people kind of put aside that this is and we all hope this is the biggest experience we all have in our lifetime to respond to a catastrophe like this. And I think we did. The challenge is is how do you work with governments to streamline the process, to keep the things flowing, that get the products delivered to save people's lives. And that's the viewpoint we took at GE. And I think also we want to sort of assess, tell us what we could do better. Tell us what we should consider doing differently the next time, manage through the chaos of different jurisdictions, not just governments, but the different jurisdictions between industry, government, the healthcare system, the hospital system, the physicians. It's an ecosystem that was tested. I think we did okay, but we want to be even better the next time.
Thank you, John. Back to you then, Mr. C, building on your very first response about vaccine nationalism, but the particular concern raised by one of our participants about the United States and its contribution to initiatives such as Gavi, which will be a big part of the COVAX facility, and other major players such as the European Union.
In a crisis of this magnitude, it is unavoidable that politics get involved. But politics can be part of the problem, but it can be part of the solution. We would like to see politics being part of the solution. Politics that is guided by science, by facts, and not by populism and fake news. Politics, that is releasing funds and make the necessary investments at national level and at an international level. Politics that will be promoting equity and equitable access, for all who need it. Politics that will be promoting solidarity instead of exclusion and unnecessary competition. And that is that kind of a politics, that we need, that will be bringing a very strong pillar alongside science, alongside activism, and the kind of movements that we would like, to see, happening. Now, too little made so far from all countries without, exceptions. We salute, some of the initiatives, ACT accelerators, the COVAX facility, all of that, good initiatives, but not good enough at the scale and the magnitude of the pandemic that we're seeing. We need to build on those and encourage, greater investment in WHO, greater investment in communities, greater investment in civil societies, greater partnership with private sector, so that together we get to the scale and magnitude that is matching the scale and the magnitude of the pandemic of today.
Thank you, Mr. C. To finish up, Professor Larrick, I'm so sorry we won't have time to take other questions, but we'd love to hear, Professor, about the role of civil society once more. On the broader recovery agenda, I will sneak in, though, a question that came in on healthcare system reforms as part of broader socioeconomic recovery from COVID, some of the lessons we're taking. So any insights that you would like to share?
Well, given we don't have much time left, but I want to make 2 points here. And one is that, civil society contributions to both tackling the crisis and contributing to the recovery, they come in all shapes of forms, large and small, and many different dimensions. And actually, in that sense, I also want to point out it's great to have another great reason to have Mr. C on the panel is that he was Secretary General of the International Federation of the Red Cross and Red Crescent Societies, which reminds us that next to the International Committee, we have virtually in every country in the world a Red Cross or Red Crescent society that really does the important groundwork. But also, it's not just, we shouldn't just think of contributions directly related to, I don't have to make face masks or provide medical aid, but also if we think of civil society organizations that, it comes down to the level of these live streaming of concerts and operas or taking care of the elderly or marginalized groups. So it really comes in all shapes and forms. One thing that does worry me, though, but shows also a connection between these different developments, is that we've seen in recent years a so-called shrinking public space, onslaughts and attacks against civil society in many countries around the world, which will also impact, which limits also the ability of civil society organizations to contribute to long-term recovery. So in that sense,
My apologies, Professor Larrick. We do have to wrap up now. I do want to be able to thank our amazing panelists, Mr. El-Haj, John Scheffler, Christina Pepku, and of course, Professor Larrick, our colleagues from the Doha Forum, and the Stimson Center. We wish everybody, though, in our global audience to enjoy the rest of the WISH Summit program heading into day 5 tomorrow. Thank you once for your amazing contributions, and we look forward to being in touch soon in the post-pandemic era.